Bennell.
Hi, I'm Alice and I'm a phlebotomist. It's nice to meet you.
Nice to meet you.
I hear you have some questions for me.
I do.
Okay, well have a seat and we'll get
Thank
started. Okay, I'm ready.
First question, what is a phlebotomist?
A phlebotomist is any person that takes blood from another person in order to run blood tests that a doctor might have ordered for you.
What do you have to do in your job?
Well, actually, there are a lot of things that I'm responsible for doing. Many people think that being a phlebotomist means only taking the blood and that's it. But I have to make sure that all the materials that I use for each patient are organized, that they're all ready to go, and they're sterilized. And after I take your blood, I am then responsible for taking that blood to the lab where it has to be stored correctly. Depending on the test that the doctor wanted me to run for you, it might have to be stored in the refrigerator at a certain temperature, or it might even have to be put inside a machine that's called a centrifuge. Do you know what a centrifuge is? Have you ever heard of that?
I think it rings a bell. I think my uncle has one. It spins the blood around so that it doesn't clot.
That's right, exactly. Good for you. Not many kids your age know what a centrifuge is, and we use them every day. Great. Okay.
Okay, where can you go to get a job in this field?
Phlebotomists are always needed anywhere and everywhere you go. That's the great thing about being a phlebotomist. We work not only in hospitals, but we can also work in doctor's offices. We might work in a health clinic. You can even work for the American Red Cross, or depending on how much training you have, you can even work for a lab company, not only taking blood from patients, but also performing the tests also. Phlebotomists are always in demand. You can always get a job as a phlebotomist.
Okay. What kind of training do you need to become a phlebotomist?
Well, it depends on the state in which you live. Every state has different requirements. So if you are thinking about pursuing a career in phlebotomy, you need to check with your state first. Some states only require that you have a certificate. Usually certificates take between 2 to 4 months of training to get, but other states require that you actually have a diploma, usually a 2-year diploma known as an associate's degree. But remember, no matter what your state might require, the more training you have, the more certificates and the more degrees you have, the more you're going to get paid, the more in demand you're going to be, and the more responsibility you'll have. Not only will you be certified to draw blood, but you will be also able to work in those labs performing the tests as well as other jobs also.
Okay. My last question, if the doctor tells me I have to have blood drawn, can you tell me or show me what to expect? I don't really like needles. They kind of scare me.
A lot of people don't like needles. I hear that all the time. The first thing you're going to do is you're going to come in and sign in, and then I will call your name and verify your name and probably your birth date to make sure that it matches the label that I have to make that goes on your vial. Then I'll sit you in a chair and I'll ask to see your arm and get you to push up your sleeve, and I will take a rubber piece of band and tie it around your arm up here kind of tightly. And I'll also probably take my finger and thump the crook of your arm. This place in your elbow is always the easiest to draw blood because the veins that are in your elbow are the ones that are closest to the skin. I also will ask you probably to clench your fist, or I might even give you a squeeze ball to hold. Both of these, tying up here and clenching your fist, will help get the blood rushing through that vein and will lift that vein up to the surface of your skin where I can see it and feel it. Then I'll disinfect the area and sterilize it with a cotton ball and alcohol. Then I'll say, okay, I'm going to get my needle ready. If needles bother you, look away and take a deep breath. and I'll say, you might feel a little bit of a stick, and I'll stick the needle in and I'll pull back on the syringe and fill it up, and I'll say, okay, I'm almost done, and I'll pull it out and say, okay. And I'll put my vial of blood off to the side. I'll give you a piece of gauze and tell you hold it in place like this, and I'll get you a Band-Aid and another piece of gauze, seal it up. I might even wrap some colored gauze all the way around your arm. I'll sometimes even let you choose red, blue, purple, and that'll be it. And then I will take your vial of blood to the lab, and the doctor will call you in 2 or 3 days with the results. And that's all there is to it. It's really not that bad. Not that bad. Do you have any other questions for me?
Well, actually, I thought that this was where the veins were closest to the skin.
Some people actually do end up having to have their blood drawn from this area here, especially the older you get. Your skin is not as tight. It becomes very loose and almost looks like crepe paper. Veins will sometimes roll, and those people are much trickier to prick than others. But we usually try to start in the crook of the arm before we go into the wrist. If you're having an IV that will pump fluids into you, if you were staying overnight in the hospital, more than likely that IV is going to be put in your wrist. But to draw blood, we're going to go here into your elbow. Those veins are larger, close to the skin, and they're usually easier to prick because they don't roll as easily as the ones here.
That's all the questions I have.
I hope that you learned something, and if you ever want to become a phlebotomist, come back and see me, and I'll point you in the right direction. I hope that you do well. Are you using this interview as part of an assignment for class?
No.
You're not having to use this for class?
Nope.
Are you doing it as an in-service project, perhaps?
Actually, yes, I am for Boy Scouts.
Excellent. Great job. Well, I know that you'll do well. I know that you'll do well. It was nice meeting you, Carter.
Nice meeting you too.
All right. Thank you very much.
Thank you too.
Follow the exit sign.
Okay, thank you.
That was